So tobacco smoke contains many chemicals. The safest chemical in a cigarette is nicotine, but this is the chemical that causes addiction. The rest of your cigarette is made up of carbon monoxide, tar, and 7,000 other chemicals that are harmful and can cause cancers. Nicotine replacement therapy is the clean part of the cigarette. It's the nicotine in a much slower, steady release and a much less nicotine than what you would receive if you were smoking. The idea of nicotine therapy is to release a boring, slow amount of nicotine up into the brain so that the receptors actually start to downregulate or fall asleep. Now, we need to use nicotine therapy for about 12 weeks as a minimum because it takes about this time for the receptors in the brain to become used to functioning without nicotine. Some people, if they have mental illnesses, may need to use their nicotine therapy for longer, or if you're just not quite sure if you're ready to stop smoking, it's perfectly okay to use your nicotine replacement therapy for longer than 12 weeks. It's always better to use that than it is to run the risk of reaching for a cigarette again. Nicotine replacement therapy can be used while smoking. If you have a lapse, while you're wearing your patches or using your gum, it's perfectly safe. In fact, we now use nicotine replacement therapy to help people to start the quitting process. So people may wear a patch or use some of the oral products and reduce their smoking along the way. And remember, nicotine therapy can work. It just needs to be used in the right dose, at the right time, and in the correct way. And it will double your chances of quitting successfully.